guidelines and instructions for what's about to come. The most awaited panel discussions and enlightening sessions are lined up for you. But before that, we will take a short break. And while you're at your break, there are 4 bowls that are set to you at the entrances, right where Mr. John Robert is standing onto your left, onto my left, onto your right, and also at the coffee stations you'll find at the exit of your right side doors. Now, please do drop in your business cards. Okay, what's in store is a lucky draw, all right, sponsored by ITC. Right, how many? I'm not going to disclose that number as yet, but then drop your cards, and then at the end of the day, we'll find out who those lucky people are. It's going to be in for today and also for tomorrow. We'll break for coffee now. Okay, you can use the door on to my right for your coffee stations. And let me also tell you, we'll have to come back here in 20 minutes. All right, and people who are arriving late, okay, please understand that you will have to entertain the people who've been waiting for you. Maybe a dance on the stage, possibly. Okay, just to keep you lightened up. All right. Also be informed that your cards, your registration tags and the cards, badges, IDs that you're wearing, comes as a package. You'll find your food coupons in it. Use them and keep them safe with you at all times. Thank you very much. Meet you in another 20 minutes.
Almost all of you are from big companies, manufacturing units, services industries, who have a lot of people working. And so emergencies, medical emergencies can happen anytime, anywhere. And most of the medical emergencies, time is very crucial. So, and as a first responder, so who is a first responder? In anyone, it need not be a healthcare professional, because it is very difficult to get someone from the medical field at the time of an incident which has happened, maybe in your institute or your factory or your office, wherever. So I will be telling you few basic things which can be done to save a life, or at least you can do something which will help him in some way or save some time. So some of those things, like what we'll do in a chest pain or someone collapses, what should we do, and mainly concentrating on what we should not do, because a lot of things we do actually harm the patient or the victim more than when we might be thinking that we are actually helping them. Like the moment someone collapses, we try to give them water and all, which is actually more harmful. If you give water to an unconscious person, it causes more harm than good. So because it can easily go into the throat, into the lungs, instead of the stomach where it's supposed to go. So if we can have the presentation up. Suppose what to do when a person is unconscious, or if he is having a chest pain, or if he collapses, and how to differentiate or how to early detect a stroke, and maybe snake bites, which is very common. We get a lot of snake bites from all the industries and manufacturing units which is in and around our hospital here in Hosur, and even dog bites, seizures, epileptic fits. So these are the common things. These are the most common things which we often get. And how to, I'm not going to get into details about the medical treatment, which I will leave it to the professionals. But as a lay person or normal non-healthcare professional, what all the things you can do to save time or benefit or help. So let's come to the first thing, which is like, we'll go one by one, maybe 4 or 5 emergencies which are common, we will discuss those. And first is maybe a seizure or an epileptic fit. So someone is having a seizure or an epileptic fit, then what do you supposed to do? What are the do's and what are the don'ts? So basically all the conditions we will divide it into do's and don'ts. So what are you supposed to do and what are you not supposed to do? So if you see someone, which is very common, a lot of times you get people who are having epilepsy on medication, and what happens is they keep taking the medicines regularly, which they have to lifelong, most of them, and they stop in between, thinking that okay, last 1 year I'm seizure free, even though I had a seizure 2-3 years back, and since I've been taking this medicine, I'm seizure free, so let's stop it and see. And the moment they stop it, in 2-3 days they get another seizure, which is often known as a breakthrough seizure. So which can happen anytime. If it happens while they're driving, it is even more risky. Or if it happens in office or in your industrial or whatever factory. So there are a few things which can be done. So things which you should not do, I will elaborate on that first. So the moment someone is seizing, don't try to restrain him or her. A lot of people, when they're shaking, it looks very scary. First of all, you should not panic. Okay, so you should not panic and ask for medical help immediately. Whichever way you want, call 108 or whatever your industry or factory or office protocol is. Like you can activate that. Secondly, don't try to restrain anybody. Let them have the fit, and don't try to put anything on the mouth. Don't try to give them anything to smell, which are common things people tend to do, but which should not be done. Only thing you can do here is try to turn them to one side, usually to the left side, so that if they vomit or if they puke or vomit, they don't choke or drown in their own secretions. So that you have to turn them to the left side. The exact position to which you have to turn them around, I will show you if the presentation comes up. There is a particular position which it's left lateral, it is called, to turn to the left side. You have to extend one hand so that it doesn't roll back or fall back. You can put something behind on the back also, so that it again doesn't become straight. Or so that's the position which is called the recovery position, so you can keep them there. And next, if usually most of the seizures subside within 3 to 4 minutes. I mean, they will seize, then they will be little disoriented, but they will be, after that it will stop. If it is more than 5 minutes, it is more risky, as the brain get damaged, chances are much higher. So as soon as possible, get them to a hospital, and there is nothing much, no medication, nothing much you can do beyond that. Then coming to something, chest pain. Suppose someone is having a chest pain while working or in your office. Again, same thing, same scenario. A lot of times we get, because ours is majorly a cardiac center, so we get a lot of cardiac patients or even non-cardiac patients who have chest pain. So the moment someone has a chest pain, and we have seen on TV or read somewhere in advertisements or somewhere that, I mean, in the moment we get a chest pain, we think it's a heart attack, but it may not be. There are so many causes of chest pain. Okay, so most common is gastritis, which will have a center and with a retching, nauseated feeling, which causes chest pain, which can mimic a heart attack. So how do you know now if you cannot know for sure whether it's a heart attack unless you investigate, do an ECG, echo, or some investigations in the hospital. But prior to that, what else you can do? What you can do, or how the characteristics of the pain in a heart attack or a myocardial infarction, which is MI, is. So first of all, the pain will be like clenching deep in a lot of tightness in your chest. Okay, and you may be sweating, you will be feeling scared, and the pain will radiate. So usually the pain radiates up your jaw or along your left arm. Okay, and most of the anginal is like the pain which is related to your heart, is aggravated or increased the moment you exert yourself. Suppose on and off you are having some pain, then somewhere you go and the lift is not working, you climb a flight of stairs and your pain increases or you feel breathless. So then it is highly likely that it is a cardiac pain instead of a non-cardiac pain. And suppose in the other spectrum, if you have a pain on your chest and you move around, like the pain increases. Suppose you move your arm, the pain increases. Then most likely it is a musculoskeletal and it has nothing to do with your heart. So then again, cardiac pain has a time window. That's why I'm stressing this is we often get, there are treatment protocols available, but the patient, be the stroke, be the heart attack, has to reach the hospital within that specific time, which is not often the case which we get here. If the patient reaches the hospital for a heart attack within 12 hours of the onset, or for a stroke within 3.5 to 4 hours, it can be saved, the tissue can be saved. There is a time limit. The further you delay, the worse it gets. So that is the reason, the moment you suspect someone, okay, these quick things you see, and you shift to the hospital. 2 medicines are there here, which any lay person can give. I will come to that, okay. So it just come up. So fits, like this is about the first aid which I said already. So you as a non-healthcare professional are the first responders. So you have we have the golden minutes, platinum minutes and golden hour, which in medicine we tell the earliest responders can make a huge difference in the survival rates. Okay, so in your offices or industry, you can have a team of people, like a protocol in place where the moment some medical emergency happens, that team gets activated or called, and they can call up the hospital and coordinate the transfer of the patient and all. Like we do in a hospital, we have a code stroke, we have a code heart attack. So we raise a code, and the relevant doctors of those departments which are concerned with that organ or abnormality will be there in minutes. So that is something which you do. I will come to some devices which you all see in airports, hotels, known as the AED or the external defibrillator. So artificial external defibrillator, how do you use that? That I'll quickly go through. These we said, these are the signs, some of the signs and symptoms of a person who is having a seizure. So this we have already gone through. Turn to one side, remove any objects, do not restrain, and call for an ambulance. This is what I was saying as the recovery position. Turn to one side. The arms and legs are stretched out like that so that they don't roll or fall back again, and they maintain this position. Okay. So do not try to restrain. Do not panic. This is the foremost thing. Most of the conditions, the patient or the people who are around panic and they take wrong decisions. Coming to dog bites, which is also very common. Off late, it is a very common thing, and a lot of people are worried about rabies, and rabies has no cure. So mostly unprovoked and provoked. Provoked are if you step on some dog's tail, maybe a vaccinated house dog or domestic dog bites you, you are relatively safe if the dog is, you know the history of the dog is vaccinated and all. Most of the rabid dogs on the street which are unprovoked bites. So the moment the skin is breached or there is bleeding, you have to go to a hospital and take the vaccines. Now earlier, there is, along with the vaccines, there is something known as the immunoglobulin, which was very expensive. Now the cost has come down. Each and every hospital has it. There is a schedule for the vaccines. 0 as is the first day, 3rd day, 7th day, 14th day, and 28th day. You have to take the injections. So, and don't cut the wound. Don't try to do anything to the wound. Just wash with normal water, clean it, and you can go to a hospital for further treatment. Do not touch the dog's saliva. Rabies spreads mostly through the saliva. And close the wounds, don't cover it, just clean it, and you can, if it is bleeding extensively, you can put a towel or some kind of compression, but that's about it. Okay, and don't kill the dog. Coming to snake bite, which I was, because we get a huge number of snake bites, and snake venom is ready available in most of the government hospitals, private hospitals, almost. There are 4 common poisonous snakes in India, and we have only one vial which acts against all 4 of the snakes: cobra, crate, Russell's viper, and saw scale viper. So among these, it covers almost 90 to 95% of the venomous snakes in India. Sea snakes are all venomous, but they don't bite. They are very shy, and we don't have an anti-venom against it. Most all of them are sea snakes are poisonous. So what we should do again, most of them, the research papers which they say, people die of snake bites because of panic. They get so scared, they get a heart attack, and actually they die not of the venom or the toxin from the snake, but more from the the panic, and it causes a heart attack and they collapse. So do not panic, just reassure. Don't give, like I said, don't give anything by mouth, and don't make him or the patient walk. Immobilize the limb and shift to a hospital as soon as possible. So a lot of things which are wrongly done. A lot of people tie a very tight cord or a bandage, and if the snake bites at the lower, end of your leg or in the fingers, they tie something very tight, thinking that if you cut off the circulation, the venom will not go, which is true to some extent. But what happens here is, the moment you tie it so tightly, your blood flow completely stops to that part, and eventually in matter of few minutes, you lose function of that part. So suppose you tie, there is no blood supply, then eventually in the hospital when you go, you lose your limb or your arm or your leg because they have to amputate. So that thing is not recommended at all, that you tie something very tightly. Neither you should cut open the wound. A lot of people cut open the wound, try to bleed it out, and thinking that the poison will go out with it. So all these practices are not recommended. Only thing, just immobilize, just keep the limb in one position, shift to a hospital, and as early as possible. Chest pain, like I said, it can be many symptoms associated. Sometimes, especially diabetics, they have very less chest pain, but they can still be having an MI. So that you have to take into account. So say some of the, if you are having palpitations, a very abnormal feeling in your heart is the heart is pounding in your chest. So some of the things like that. And again, rest, reassure, and shift to the hospital. Like I said, this is the part of the chest where the pain usually radiates in an MI or a heart attack. Okay. These are the tablets which you can give. Anyone can. I mean, a lot of people have aspirin. Even if you don't have aspirin, you can have Disprin. A lot of people take Disprin for headache commonly. So it's an over-the-counter drug. You don't need a prescription for these two drugs. Sorbitrate and aspirin. 325 mg aspirin to chew and 5 mg to under the tongue. This is again, and this is unconscious man. What you do? I'll just quickly go through because we're running short of time. First, you check response, whether the person is responding, obeying, whether he's breathing, and get help if he's not responding. You say, okay, are you okay? Tap on the shoulders and see. If you're not responding, get help immediately. Shout for help. EMS is emergency medical services. So this is CPR. I will again go very quickly. Compression, airway, breathing. This compression is the most important part, and this is how you do chest compressions. Middle of the chest, heel of one hand on top. This position, you give 30 compressions and 2 breaths. That's how you give the chest compressions. This you do only if there is no pulse. How do you check pulse? You don't check the pulse in your hand in an unconscious man. You check it on the side of your neck. If you put 2 fingers on your side of your neck, all of you can feel a carotid pulse. That is the central pulse which you need to check. Okay, so this is how to open the airway and give mouth to mouth. Even if you're not willing to give, or strangers, you're not going to give this mouth to mouth, just do the chest compressions. That is also good enough. It buys you time. Okay, so continue resuscitation. If the victim is breathing, put him in this position. If he's unconscious and breathing, just put him in the same position. This is the device which you see in hotels and airports, known as the AED, which gives, in movies you see, they shock defibrillator. You shock. This device does it entire thing automatically. You just have to press 1, 2, 3. 1 is for switching on, 2 is for analyzing, and 3, if you need the shock, the machine will itself tell. It will give voice prompts. Okay, shock, you just press. That's it. Very easy to manage this device. It can look different, but the basic concept is same. Just 3 switches. So you attach the pads like this. It will be all marked where to attach. You do not touch when the analysis is going on. And if it says shock, you shock. Press the button. Then you continue again with your chest compressions. Again, a little bit of choking. So if someone is choking, if someone is choking and speaking, you are good. That means the airway is not completely blocked because he is able to make noise. Then just encourage him to cough it out. If he is not able to speak, no voice is coming and he is choking, that is more serious. That means the airway is completely blocked with whatever foreign object it is. So we give compressions just above the belly button. Hold your arms like this and keep pressing till the thing comes out. Okay, and 4 or 5 minutes, if it doesn't come out, the patient will become unconscious. Then you go back to the BLS or basic life support. How you do? It's a very big thing. Can't say everything in detail now. Quickly, last thing, stroke. Now, stroke treatment has changed over the years. Again, like MI, it is time bound. So if it happens within 3 to 4.5 hours, the outcome is very good. A lot of people have strokes and they are lifelong paralysis, one side of the body, they're not able to move. But within 3.5 to 4 hours, if you reach an hospital, there are medicines which can be given which can reverse a stroke. So time is very important. So we have Be Fast. That's just a mnemonic so you remember. So if there is imbalance, blurring of vision, and fast is the most important thing here. Face. So see the person's face. If there is, ask him to maybe smile or talk. If there is asymmetry, one side of the face is getting pulled, it is not symmetrical. There is a deviation of the face. Then arms, ask them to close their eyes and stretch out their arms. In stroke patients, if they have deficits, one of the arm will fall down. They will not be able to hold it like this. So that is also a positive sign. Speech, if you know how the person speaks, if he or she is slurring, not able to stammering or not speaking properly, that is also a sign. So if these are the 3 things, if anything is positive, almost 90% you are sure that he or she is having a stroke. And then time is very crucial. So you will shift to the hospital immediately. So that's about it. I am wrapping up. You can ask me questions. I will be available since we are short of time. I am finishing. We have a stall outside. So this is the number emergency for Narayana. Any emergencies in and around Hosur. Thank you. Thank you very much.